Assalamualaikum and welcome into third Super 6 match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into Super 6 matches where 6 teams will compete with each other and 2 will qualify for Grand Finale, which is going to be held in next month in PHL annual meeting. Today's Super 6 match is between LNH Galaxians and BVH Rulers, and this is a decider one as it will decide who is going to play Grand Finale in PHL meeting. Today's umpiring will be done by Professor Azizur Rahman Saab. He is Professor of Medicine. Along with him, Patron-in-Chief of Cardiometabolic Premier League are Professor Javed Akram Saab and Professor Mohammad Ishaq Saab. For moderation purpose, we have with us Dr. Qurban Hussain Khan Saab. For further moderation, over to Dr. Qurban Hussain Khan Saab.
Thank you very much, Usman Saab. Welcome one and welcome all. This is match 3 of the Super 6, the final Super 6 match before the grand final in Lahore in the PHL event next month. So this is absolutely critical. We've had some brilliant contests in the Super 6s and indeed in the 18 group matches so far. Today we are joined by our patron-in-chief, Mohammad Ishaq Saab, and also by our umpire, Professor Azizur Rahman Saab. We have 2 teams willing and ready and able to do battle, and I'm sure it's going to be a wonderful contest between them. Today we have the BVH Rulers. BVH stands for Bahawal Victoria Hospital in Bahawalpur, and also from Karachi, the LNH Galaxians. LNH is Liaquat National Hospital. Last contest was a magnificent performance by the Sedu Royals. They scored 48 points. Let's see how today's teams do. Before we begin, I would like the input of our patron-in-chief, Mohammad Ishaq Saab, Professor Ishaq Saab. Can we have Professor Ishaq on the screen? Assalamu alaikum.
Welcome to all of you. Just hold on one second. Let me. Yeah, give me a second.
Looks like you are connected with 2 devices.
That's right. I'm going to switch off one.
Throw it on the floor, it will switch off automatically.
Right, sir. First of all, Assalamu alaikum to everybody. And
Assalam, sir.
it's a great pleasure to be once again on the match. This has become a Saturday morning feast for us. And I am here in Birmingham. Weather is quite good. And I'm sitting in the conservatory. Just had my breakfast. So both the teams are most welcome to contest with the patience, with thinking and answering after a careful thought among the group, you see, not jumping on the conclusion before time, 60 seconds. So I think Aziz Rahman Sahib is smiling. We have enjoyed this match. Every match has been very interesting. The last one was very, very interesting. And it gives us a good opportunity to meet friends. And I think, as we always say, this is a great learning experience for everybody, including myself and including the faculty. So with this, I would like to hand over to our worthy moderator, an excellent moderator we have. And I think we are going to have another enjoyable event today. Thank you very much.
Thank you, Professor Saab. As always, wonderful comments. Professor Azizur Rahman, your thoughts so far in the Super 6s and what you think of this contest?
Well, as Professor Ishaq said, I enjoyed the entire tournament and really looking forward to watch this match also. I think it's going to be a tight one, and let's see, my good wishes with both the team, and let's see who wins and go to the grand finale. And I look forward to see Professor Ishaq in the PHL meeting in Lahore.
Absolutely, absolutely. That will be a
and you too, probably you will also be joining, right?
I hope to be joining. Hamza Saab and I will both be moderating the final.
You need to be in the final ceremony because you played pivotal role to make it interesting. At least I think the other academic things we could manage, but to make it very, very interesting and just sound like a cricket match. It was your contribution, as Professor Ishaq said.
Thank you very much for
Exactly.
your kind words. Thank you. Thank you very much to our wonderful senior faculty, both professors, and a wonderful, wonderful addition to the effort of Wilson's Pharmaceuticals, which has powered this event. And also thank you to Pakistan Hypertension League and the Pakistan Society of Internal Medicine, who've provided a lot of the thrust for this as well. So without further ado, let's introduce the two teams. Let's start with Karachi, 𝐏𝐚𝐤𝐢𝐬𝐭 National Hospital Galaxians, wonderful name. Can we have them on screen, please? Assalamu alaikum, Galaxians. How are you feeling today?
Walaikum Assalam. We are excited about the competition, and we hope that we win this with a great margin, inshallah.
Excellent, excellent. Can you introduce yourselves as the captain and the other members of the team, please?
My name is Dr. Basir Khan. I am a Year 4 resident and in the Internal Medicine Department, and I have my team here, and I'm joined by the...
I'm Dr. Fahad, and I'm also a senior resident from the medicine department.
I'm Dr. Sabahat Ghafoor, and I'm Year 4 resident from the same department.
My name is Dr. Sinesrar. I am senior resident R4 of same department.
Well, it's wonderful to have you back. You performed brilliantly in the last round. We watched your match over again, and you were absolutely brilliant, and you deserve to be here. It's going to be a very, very tough competition today. Your opponents are brilliant, just like you are, and it's going to be extremely tight, and I wish you the best of luck. Good luck, Galaxians.
Thank you.
Now, to Bahawalpur, Bahawal Victoria Hospital, welcome. Welcome, rulers, to this Super 6 contest. Welcome, and can you introduce yourselves as the captain and the other members of the team?
Thank you for the welcome. I am Dr. Bilal, first year resident, internal medicine.
Assalamu alaikum. I'm Dr. Amar Adar, resident R1, FCPS medicine.
I'm Dr. Ansar, second year cardiology resident in BVH.
Dr. Hansla, R1, BVH, internal medicine.
Okay, wonderful. Well, you performed brilliantly well in the last round. To make it to the Super 6 is a wonderful achievement in itself, and it's going to be an extremely tough competition today. I wish you all the best of luck.
Thank you.
Thank you.
Can we have the coach of 𝐏𝐚𝐤𝐢𝐬𝐭 National Hospital, Dr. Samar Abbas, please? Dr. Samar Abbas? Okay, we'll try and get Dr. Samar back as soon as we can. So let's start. We'll do it with alphabetical order then. Bahawal Victoria Hospital rulers will do the coin toss. Coin toss will determine who goes first and who answers what case. So, BVH, are you ready?
Yes.
I want you to pick either heads or tails.
Heads.
Okay, they've chosen heads. Let's roll the coin. Let's see whether they're right. Is it heads? It is heads. It is heads. So you've won the first part. Let's see if you can do something with your choices. Do you want to ask questions first or answer questions first? Think carefully.
Sir, let them answer first.
Okay, you're going to chase. So you're going to let your opponents, the Galaxians of LNH, answer questions first. Since you won the coin toss, you are going to choose which case goes first. So, okay, let's let LNH choose first. LNH, are you on the screen?
Yes, we are.
LNH, LNH, can we have LNH
Yes,
on
we
the
are.
screen, please? LNH,
Camera
you
Yes, we are on the
by
screen.
default, Bahawalpur has won the coin toss, and they are going to choose which case you are going to answer. Can we have a reaction from you? Does that suit you, or does that kind of go against what you were planning?
We are okay with it. Yeah, we
So-
don't have any problem, and we'll go for the answering first.
Okay, that's fine. You're confident, they're confident. Back to Bawalpur. Bawalpur, you're going to choose case A or case B for your opponents to answer. So which case should the Galaxians answer? Is it case A or case B?
Case B.
Okay, you've chosen case B. So case B is what Liaquat National are going to be answering. And you, my dear friends, are going to be asking the questions after reading out the case. So are you ready?
Yes, we are.
Okay, let's begin. Let's begin with the first case. Bawalpur, read it out, please.
A 62-year-old man with obesity, BMI 36, type 2 diabetes, HbA1c 8.4%, resistant hypertension, and mixed dyslipidemia presents for follow-up 1 year after non-ST elevation myocardial infarction. He is currently on aspirin, atorvastatin 80 milligrams, lisinopril, and metformin. His blood pressure is 148/88. LDL cholesterol is 88. Triglycerides are 180, and eGFR is 52. He is sedentary and struggles with weight loss.
Okay, LNH, did you catch that? Did you catch the history?
Yes, so we have read the case.
Okay, you're ready to go then. Let's start with question 1. BVH rulers, read it out.
In the Fourier trial, what was the effect of evolocumab when added to statin therapy in patients with established atherosclerotic cardiovascular disease? Is it A, evolocumab significantly reduces LDL cholesterol but had no effect on cardiovascular outcomes? Evolocumab produced a 15% relative risk reduction in the composite of the cardiovascular death, myocardial infarction, and stroke. Evolocumab reduced triglyceride levels, and this was the primary driver of benefits. Evolocumab provided benefit only in patients younger than 65 years. Evolocumab was neutral in efficacy in patients with diabetes.
Start the clock. Let's have the Galaxians on screen. Galaxians on screen. So, it's the Fourier trial. We're talking about evolocumab, and a very specific answer is required here. Good that you're talking. Keep your microphone on, please. Microphone's on, please.
Microphone is on.
Good. 20 seconds, guys. You're going to have to pick. If you don't know, you're going to have to guess. Times are ticking.
Option D, evolocumab provided benefits only in patients younger than 65 years.
Okay, no time to discuss. Option D, let's look. No, they went for option D. They discussed amongst themselves. They took their time. They did everything Professor Ishaq told them to do. But unfortunately, they faced a short ball and they tickled it to the keeper and they are caught out first ball. So, one question, one wicket. They haven't yet troubled the scorer. Not to worry. These matches are tough. So, there will be opportunities to score later on. So, unfortunately, question 1, not off to a flyer, but let's see if we can get off on the second ball. Question number 2, please. BVH, read it out.
According to the EMPA-REG outcome trial, what was the major demonstrated effect of empagliflozin in patients with type 2 diabetes and high cardiovascular risk? A. Empagliflozin reduced weight loss only without cardiovascular impact. Empagliflozin lowered HbA1c but showed no effect on cardiovascular outcomes. Empagliflozin primarily reduced the risk of ischemic stroke. Empagliflozin significantly reduced hospitalization for heart failure and cardiovascular death. Empagliflozin had a completely neutral effect on atherosclerotic cardiovascular outcomes.
Start the clock.
Yeah.
So let's talk about EMPA-REG outcome and empagliflozin. What was the demonstrated effect in these patients? Galaxians on screen. Take your time, guys.
Option D, empagliflozin significantly reduced hospitalization for heart failure and cardiovascular death.
Okay, that's fine. They seem very sure. Are you sure?
Yes, we are sure.
You're sure? If you're sure, then we are sure. Let's lock in option D. Option D, option D, option D, yes! Option D, they are there. They are off the mark. This time they aggressively cut the ball in the air and it's gone past third man in the air over the boundary rope for a sixer. So they are off the mark, off and running and ready to put some pressure on that scoreboard. Well done, Galaxians, well done. Let's move on to question 3 now.
In the LEADER trial, which outcome was associated with liraglutide therapy in high-risk patients with type 2 diabetes? Liraglutide reduced hospitalization for heart failure but had no effect on atherosclerotic events. Liraglutide significantly reduced the composite of cardiovascular death, myocardial infarction, and stroke. Liraglutide was neutral with respect to major adverse cardiovascular events. Liraglutide increased the risk of pancreatitis without cardiovascular benefit. Liraglutide showed benefit only in patients with the body mass index below 30.
Start the clock. Liraglutide, the LEADER trial, high-risk patients with type 2 diabetes. What did we discover in the LEADER trial? The answer is for the Galaxians to come up with. Let's have them on the screen. So a bit of discussion going on. Half the time has elapsed. Take your time, guys. You've got time. Ten seconds. 9, 8, 7, 6. Come on, guys.
C. Liraglutide was neutral with respect to major
Okay,
adverse
let's lock it
cardiovascular.
in. The time is gone and you've locked in C. Let's see. Are they right? Are they right? No! No, not again. They were wrong. They were wrong. They discussed it. They reasoned it. They went through everything. But alas, they couldn't come up with the right answer. This time they faced the fast bowler. He bowled it right at the stumps, and at the last second it swung in and it smashed. It smashed their middle stump and it is out of the ground and they are out. They are out. But are they out of this contest? That remains to be seen. So some tough questions at the beginning asking about critical landmark cardiovascular trials, diabetes trials, and that was tough. I have to say that was very tough. Question 3 is done. Let's move on to question 4.
Which therapy should be added to metformin in an obese patient with prior MI and an HbA1c of 8.4% to most effectively reduce atherosclerotic cardiovascular disease? A DPP4 inhibitor, a sulfonylurea, a thiazolidinedione, basal insulin, a GLP-1 receptor agonist.
Start the clock. Galaxians on screen.
Option E, a GLP-1 receptor agonist.
Okay, you've answered relatively rapidly. Are you sure?
Yes, we are sure.
Okay, no consultation going on now, so they must be sure. E, lock it in. Yes! Finally, this time they were aggressive, they played the spinner and they swept him. They swept him in the air and over long off for 6. Well done. So, score of 12 from 4. Question 5, read it out please.
In a patient with established cardiovascular disease and stage 3 chronic kidney disease, eGFR 52, which therapy provides best cardiovascular and renal benefit? A. DPP4 inhibitor, a GLP-1 receptor agonist, an SGLT2 inhibitor, sulfonylurea thiazolidine.
Start the clock, 60 seconds. Renal and cardiovascular benefit. Which one? Let's have Galaxians on.
Option C, SGLT2 inhibitor.
Option C, SGLT2 inhibitor. Is that the opinion of all of you, Captain, or just a
Yes,
few?
that is our answer.
Unanimous, and let's see if
Yes.
they're right. Option C, are they right? Are they right? Yes, they're right. You bet they're right. Well done. Well done, Galaxians. After a shaky start, you're off and running, and you've got a reasonable score in the first 5 questions. You've got 3 of them right, which is okay. It's okay. You're in the hunt. You are in this match. So you've driven the ball over the bowler's head into the side screens for another sixer. Well done. Next, question 6.
What is the recommended blood pressure target for secondary prevention in a patient with diabetes and established cardiovascular disease? Blood pressure should be maintained below 130/80. Blood pressure should be maintained below 140/90. Blood pressure should be reduced to below 120/70. Blood pressure should be reduced to below 150/90. No specific blood pressure target is required for secondary prevention.
So a bit of knowledge on the guidelines. Most guidelines have a blood pressure cutoff.
Option A, blood pressure should be maintained below 130/80.
Are you sure? You've got
Yes,
time.
we are sure.
Okay, they're sure. Let's lock in option A. They're right. They are right. This question, similar themes have come up in previous contests as well, and the umpires have clarified it in previous answers as well. And it's a very, very good learning point. I'm delighted that the Galaxians have picked up on it. 130/80 is the blood pressure target. The blood pressure should be maintained below it, and they've done it. So they have played, the fast bowler bowled at them, it's short, and they have tickled it down the leg side, and it's gone in the air and past fine leg for another 6. So that's really, really good batting. Very, very good play by the Galaxians. Score of 24. 4 more to go. Maximum of 48 possible. Question 7, please.
According to current ESC and ACC AHA guidelines, what is the most appropriate long-term antiplatelet strategy for a patient with diabetes 1 year after non-ST elevation MI, which has tolerated dual antiplatelet therapy without bleeding? Aspirin plus prasugrel should be continued indefinitely in all post-acute coronary syndrome patients. Dual antiplatelet therapy with aspirin and ticagrelor may be considered in patients with high ischemic risk and low bleeding risk. Clopidogrel monotherapy should be replace aspirin as it is superior for long-term secondary prevention. Antiplatelet therapy should be discontinued entirely after 12 months and to reduce bleeding risk. Aspirin monotherapy should be continued in all patients as prolonged dual antiplatelet therapy is contraindicated.
Start the clock. Highly discriminatory question here. Half the time has gone. The Galaxians are in consideration. Going through each and every point, discussing. 15 seconds to go. 10 seconds. We're going to need something soon, Galaxians. 5, 4.
Option B. Option B.
Option B, after a lot of deliberation, a lot of discussion. Option B, lock it in. Brilliant. Absolutely brilliant by the Galaxians. That was not an easy question, not an easy question at all. They discussed, they cajoled each other, they got the answer, they teased it out. They got to the truth eventually, and that was very, very subtle, a very discriminatory question there. Well done to the Galaxians. They are fighting, they are fighting. So they've once again gone down the pitch to the spinner and slogged it. They have slogged it down the leg side, and it's caught by the crowd. Well done, Galaxians. They're in the hunt. Maximum of 48 possible. 30 is the score so far. 3 to go. Question 8.
Which pharmacologic therapy for obesity has demonstrated the strongest evidence of reduced cardiovascular events in randomized controlled trials? Very low calorie diets, orlistat, semaglutide, phentermine, topiramate, vitamin D supplementation.
Clock has started.
Option C, semaglutide.
Option C. You're sure about that?
Yes, we are sure.
Let's have the Galaxians on screen, please. Okay, let's lock it in. They've gone for option C, semaglutide. Are they right? Yes, they're right. They're building up momentum now. That's the 5th correct answer in a row. After a slightly shaky start, they've got a very good score building up. So they have a score of 36 from 8 questions, and they are fighting. They are really fighting hard for this. Let's move on to question 9.
Which dietary intervention has the strongest evidence for improving cardiometabolic risk factors, particularly blood pressure in patients with type 2 diabetes and cardiovascular disease? The DASH diet has been shown to significantly lower blood pressure and improve metabolic control. A high protein ketogenic diet has been proven to reduce major cardiovascular events. A very low fat diet is superior to the Mediterranean diet for cardiovascular prevention. Vitamin supplementation is strongly recommended for cardiovascular disease reduction. A low glycemic index has stronger evidence than all dietary patterns for ASCVD prevention.
Start the clock. It's about diet. It's a common theme in the Cardiometabolic Premier League.
Option A, the DASH diet.
Option A, DASH diet. There are lots of diets here. Ketogenic diet, low-fat diet, low glycemic index diet. You're sure about DASH diet?
Yes, we want to go for the DASH diet.
Okay, let's lock in. Option A, DASH diet. Yes, DASH diet. Significantly lowers blood pressure and improves metabolic control. Galaxians are off and running. 6 in a row. This time they waited. The spinner bowled it, and it was wide outside the off stump, and they square cut. They square cut it so hard that it's out of the stadium and on the road outside the stadium. So that's where the ball is. You're going to have to get some kid to go and pick it up because it's a 6. Now, one more question. They've got a really good score, 42, but they can really bump it up and become extremely competitive now. 48 is possible. Let's see what they've got. Next question.
What is the most appropriate HbA1c target for a patient with type 2 diabetes and established atherosclerotic cardiovascular disease? A. HbA1c should be maintained at below 7% in most patients. HbA1c should be reduced to below 5.5% in all patients. C. HbA1c should be aggressively reduced to below 6% in all patients. HbA1c should be maintained at approximately 8% for all patients. E. No HbA1c target is recommended in patients with cardiovascular disease.
Start the clock.
Option A, HbA1c should be maintained at below 7% in most patients. Option A.
Right out of the blocks. Option A. That's a quick answer. You took 3 seconds before you started talking So are you sure, Captain? Is this the opinion of your team? You can confer.
Yes, we are sure. Lock it.
Okay, let's lock it. Option A, 7%. Lucky 7. Seventh heaven. They're there. They are there. They've got a great score of 48, which is the same score as the Sedu Royals brilliantly achieved earlier on this week. So that is an absolutely magnificent score and a great effort by the LNH Galaxians after a very difficult start in the first 3 questions. Wonderful performance. Wonderful performance. So I think they can be extremely proud of the effort that they put in. I would like some feedback from our senior professors. Professor Ishaq Saab, are you there, sir?
Yeah, I am very much there, and I enjoyed the inning. I think they played very well. 1 or 2 questions were a bit difficult. The trial questions are always difficult to be updated. 1 or 2 questions were quite straightforward. So it was a balanced questions, answers. And I think they fought very well. My congratulations to them for a very good score. Now let's see what the Bawalpur team is going to achieve. It's quite a good score that they have attained. So again, very welcome and very good. All the compliments for the Galaxians. So far, so good. Excellent performance. And some of the questions they just spotted immediately. They were so confident. And this 130-80, I think, came from one of our previous matches. And I think they've been listening to it. 130-80, as far as blood pressure is concerned, is the optimal goal that we tend to achieve. So once again, I enjoyed. Sometimes we feel that we are not listening to medical questions, but we are sitting in a stadium and watching a cricket match. I was never aware of these terms that you use in your moderation, you see. So thank you very much for improving my knowledge of cricket as well. So thank you. Well done. Let's see how the other team performs. So far, it was a very good experience to listen to them and their answers. Thank you.
Thank you, Professor Saab. Professor Azizur Rahman, can we have Professor Azizur Rahman on?
Yeah, I wanted clarification. Can you get back to question number 2, please?
Question 2. Can we have question 2 on screen, please?
This is about empiric trial, right?
Yes.
Yeah. Did they answer this question correctly? I think they did.
Yes, they did, sir. Yes, they did.
Okay, right. Okay, I think then the match was okay. I mean, of course, they performed well. And they had performed better earlier also. That's why they're here. Now, let's watch the other team also. I think then we'll see which team wins. But the team who just played, they performed really well.
Thank you very much for your kind comments, sir. Thank you. Let's move on to the next stage of this contest. So we've had 1 innings and LNH Galaxians performed magnificently. They hit everything that they could. There were some tough questions in there. They weren't able to get the maximum, but this is Super 6 and the questions are tougher than the original preliminary round, so we don't expect everyone to score full marks. Let's move on to the BVH rulers. Let's see how they do. Can we have the next case on screen, and can the Galaxians please read out this case?
A 58-year-old male with a body mass index of 34 kg per meter square, poorly controlled type 2 diabetes mellitus, HbA1c of 9.8%, resistant hypertension and mixed dyslipidemia, presents with acute chest pain and dyspnea. His blood pressure is 188 by 100 millimeters of mercury. The electrocardiogram shows an anterior ST elevation, myocardial infarction, and he undergoes urgent percutaneous coronary intervention with drug-eluting stent. On day 2, his serum creatinine increases from 1.2 to 1.9 milligrams per deciliter. Laboratory results shows LDL cholesterol 172 milligram per deciliter and triglycerides 305 milligram per deciliters.
Rulers, did you get that? Did you understand the case?
Yes.
And you're ready to proceed with the questions?
Yes.
Yes.
Okay, best of luck. Let's start with question 1. Galaxians, read it out.
According to the Plateau trial, what was the main clinical advantage of ticagrelor compared with clopidogrel in patients with acute coronary syndrome? Option A, ticagrelor produced no difference in major bleeding compared with clopidogrel. Option B, ticagrelor showed benefit only to patients with ST elevation myocardial infarction. Option C, ticagrelor was associated with reduced ischemic events but an increase in overall mortality. Option D, ticagrelor significantly reduced cardiovascular death, myocardial infarction, and stroke compared with the clopidogrel. Option E, ticagrelor demonstrated neutral efficacy in patients with type 2 with diabetes compared to those without diabetes.
Start the clock. It's about the Plato trial.
इसकी जो बेनिफिट है ना, बेनिफिट को इससे सबसे अच्छा होता है, टीका सबसे अच्छा होता है।
30 seconds. Doesn't.
It's delta D.
D for Delta. Are they right? Let's see if they're off to a flyer. D, lock it in. Yes. The Plato trial. That landmark trial which introduced most of us to the understanding of ticagrelor. Wonderful. So they are off to a flyer. They have waited for a delivery which is in the slot, and they have smashed it on the off, in the air, and over the boundary line for another sixer. So they are off to a flyer, and they are on course to win this match. Next question. Question 2.
In the IMPROVE-IT trial, what was the effect of adding ezetimibe to simvastatin therapy after acute coronary syndrome? Option A, ezetimibe primarily lowered triglycerides, and this explained its beneficial effect. Option B, ezetimibe produced a modest but statistically significant reduction in cardiovascular death, myocardial infarction, and stroke. Option C, ezetimibe was effective only in patients without diabetes, while no benefit was observed in those without diabetes. Option D, ezetimibe showed no impact on cardiovascular outcomes despite lowering LDL cholesterol. Option E, ezetimibe demonstrated a completely neutral effect with no subgroup showing significant benefits.
So option C was ezetimibe was effective only in patients without diabetes, while no benefit was observed in those with diabetes. That was the correct reading of that option. So we're talking about IMPROVE-IT and ezetimibe being added to simvastatin after an acute coronary syndrome. So BVH rulers, you are on the spot. You've got half a minute left.
It's beta.
B for beta. Mama. Okay, let's lock it in. Option B. Yes. Another great score by the rulers. So once again, you waited for the right delivery. This time you flicked it off the pads, and it's gone once again high over that boundary, caught by the crowd. It is another sixer. Well done, BVH. You are building up pressure. You are building up a great score, I hope. Next question. Question 3.
In the REDUCE-IT trial, what was the demonstrated benefit of icosapent ethyl when added to statin therapy in patients with elevated triglycerides? Option A, icosapent ethyl significantly reduced the risk of cardiovascular death, myocardial infarction, and stroke by approximately 25%. Option B, icosapent ethyl reduced triglyceride levels but had no impact on cardiovascular outcomes. Option C, icosapent ethyl showed a neutral effect on the primary cardiovascular outcome overall. Option D, icosapent ethyl reduced the risk of pancreatitis but did not affect cardiovascular events. Option E, icosapent ethyl provided benefits only in patients without diabetes.
Start the clock. We're talking about the Reduce It trial and the effect of icosapent ethyl when added to statin therapy.
It's A.
A.
The answer is A.
Okay. A is your answer. Are you sure? You've got time.
Yes.
You're sure?
Yes.
Okay.
Yes,
Lock it
it's
in. A.
Yes.
A. Yes. A. A is the right answer, and they are off to a real flyer here. 18 points from 3 questions answered. So that is a brilliant, brilliant start. And they are really building up pressure now and building up momentum. Well done, BVH rulers. So next question. Question 4, please.
Which glucose management strategy is most evidence-based for patients with acute coronary syndrome and persistent hyperglycemia? Option A, the patient should be restricted on metformin with careful renal monitoring. Option B, the patient should be treated with a basal bolus insulin regimen with the goal of maintaining glucose levels below 120 milligrams per deciliter. Option C, the patient should be started on sulfonylurea to achieve rapid glycemic lowering. Option D, the patient should be initiated on SGLT2 inhibitors during hospitalization. Option E, the patient should receive an intravenous insulin infusion titrated to maintain blood glucose between 140 and 180 milligrams per deciliter.
Clock starts now. Persistent hyperglycemia in acute coronary syndrome. What's the best approach here? I have to say the answers are all kind of, any of them could be right, but it's just a question of getting the best answer.
It's E. The patient should receive an intravenous insulin infusion.
Are you sure? Is that the opinion of all of you?
Yes.
Option E.
Yes.
Lock it in. Option E for epsilon. Yes, they are right. They are right. That's great. So that intensive glucose control is not what's required. A slightly more relaxed approach to the glucose is what's required in this situation. There is data about SGLT2 inhibitors during hospitalization for heart failure, but not necessarily for acute coronary syndrome to that extent. So that was the logic behind option E, and they got it right, and they are flying. A score of 24 from 4. They are really, really dominating this match so far. Well done, BVH. Question 5, please.
Which intravenous antihypertensive is most appropriate in a patient with ST elevation, myocardial infarction, and pulmonary edema? Option A, intravenous esmolol. Option B, intravenous nitroprusside. Option C, intravenous hydralazine. Option D, intravenous labetalol. Option E, intravenous nitroglycerine.
The clock starts. Not an easy question. All of these agents are used to treat hypertension in an acute setting. So they are going to have to choose the best one. "30 seconds, rulers."
It's E, intravenous nitroglycerine.
E for intravenous nitroglycerine. Are you going to change your mind? No?
No.
Okay. Option E, intravenous nitroglycerine, nitro. Are they right? You bet they're right. They've got that cushion of the 4 previously correct answers, and so this time they have charged the spinner. They have charged the spinner, and he has been smashed, hauled on the offside for another sixer. So that is real pressure, a real good score being built up here. 30 out of 30 potential points. Brilliant by Bahawalpur. Brilliant. Question 6, please.
What is the most appropriate immediate lipid-lowering therapy for a statin-naive patient presenting with ST elevation myocardial infarction with an LDL cholesterol of 172 milligrams per deciliter? Option A, high-intensity statin therapy should be initiated within 24 hours. Option B, ezetimibe should be initiated before starting a statin. Option C, niacin should be used as the first-line therapy. Option D, a moderate-intensity statin should be started and titrated later. Option E, fibrate monotherapy should be initiated as the primary treatment.
Start the clock. Lipid lowering therapy in ST elevation MI.
It's A, high intensity statin therapy.
A for high intensity statin therapy. You're agreed as a group?
Yes.
Okay, they're agreed. So let's stop the clock and lock in option A. Option A. Another sixer. So 6 sixes. They are really dominating the bowling today. Nothing is getting them down. They are absolutely unflappable and unstoppable. Nothing can stop this Bahawalpur Express from destroying the opposition, and they are in pole position. They only need another 3 correct answers to win this match outright and book a place in the final most likely. So let's go on. Question 7.
A patient remains on atorvastatin 80 mg daily 6 weeks after an acute coronary syndrome, but his LDL cholesterol is 95 mg per deciliter. What is the next recommended step in therapy? Option A, ezetimibe should be added to the high-intensity statin. Option B, the patient should be switched to a moderate-intensity statin and ezetimibe. Option C, a fibrate should be added to reduce triglycerides. Option D, niacin should be added to increase HDL cholesterol. Option E, a PCSK9 inhibitor should be used immediately instead of ezetimibe.
So question 7, lipid lowering.
It's alpha.
A for alpha.
Citizen should be added.
Okay, let's lock in. A for alpha. They're sure, so we're sure as well. And they're right. They are absolutely right on the money. Absolutely right. And they are hammering these questions. They are absolutely destroying the field. 7 out of 7, a truly magnificent score given the level of competition at this phase. So let's move on to question 8. Let's see how they can do. Can they get a full house? Can they get 10 out of 10? Let's see.
A patient on statin and ezetimibe therapy still has an LDL cholesterol of 105 mg per deciliter. Which additional therapy provides the largest incremental risk reduction? Option A, a fibrate therapy should be used to target triglycerides.
Okay, let me read out the option. I think there's been a mistype. Option A is a fibrate should be used to target triglycerides. Full stop. Option B is niacin should be added to further raise HDL cholesterol. Option C is a PCSK9 inhibitor should be added to the current therapy. Option D is a bile acid sequestrant should be introduced. And option E is omega-3 fatty acids containing EPA and DHA should be started. BVH.
It's Charlie PCSK9 inhibitor should be added.
Okay, is that the opinion of all of you?
Yes.
Okay, let's lock it in. Charlie, a PCSK9 should be added to the current therapy. Lock it in. No shock there. Another absolutely bang on answer. Unfortunately, there was a slight misprint on the thing, but I'm sure that the team knew what the correct answer was anyway. So option C is the correct answer. PCSK9 inhibitor should be added to the current therapy. So you are tied with the Galaxians, 48 all. You just need one more decisive blow to book your place most likely in the final. Let's have question number 9, critical question now.
A patient who had a myocardial infarction is on maximally tolerated statin and ezetimibe therapy but has triglycerides of 305 mg per deciliter. Which additional therapy has proven benefit in reducing cardiovascular events independent of LDL cholesterol levels? Option A, icosapent ethyl should be added to statin. Option B, fenofibrate should be added to reduce triglyceride levels. Option C, niacin should be added to raise HDL cholesterol. Option D, a PCSK9 inhibitor should be prioritized before triglyceride management. Option E, omega-3 fatty acids containing EPA and DHA should be added.
It's alpha icosapent ethyl should be added to the statin therapy.
Okay, icosapent ethyl should be added to statin therapy. Is that the answer of all of you or just a few of you?
Yes, we are sure.
Okay, you're sure? That's fine. So, are you right? Option A, lock it in. Yes, you are right, and you have won this match. Congratulations.
Thank you.
Thank you.
You won the match. The match isn't over, but you've already won. You have already won, and that was brilliant. You swept the spinner behind, and it went in the air, and it missed the field, and it has gone for 6. It's hit the advertising hoardings behind the pitch. So that is a winning blow there. 54, magnificent score and a brilliant effort there. Question 10. Let's see how you do. Can you score a perfect score in the Super 6? You'd be the only team to do so. Question 10.
Which of the following best describes the role of high-intensity C-reactive protein, HSCRP, in the management of patients following acute coronary syndrome? Option A, HSCRP is a core diagnostic marker for acute myocardial infarction and replaces troponin in high-risk patients. Option B, HSCRP provides no prognostic information in cardiovascular disease and should not be measured. Option C, elevated HSCRP after myocardial infarction is associated with increased risk of recurrent cardiovascular events and mortality. Option D, HSCRP is a mandatory therapeutic target in all the guidelines for lipid management after myocardial infarction. Option E, HSCRP should be measured only in patients with chronic kidney disease and cardiovascular disease.
Start the clock. High sensitivity C-reactive protein in the management of patients following acute coronary syndrome. Which is the right answer? There's a lot on this. Nobody else has scored a perfect 10. And BVH rulers can write themselves into legend if they get 10 out of 10 correct. "25 seconds left. They've got time."
It's Charlie C. Elevated HSCRP after MI.
On this, you are going to blast your way to the national finals if you get this right. So are you sure?
Yes.
Okay, you're sure. C, to win it. Yes, they've done it. They have done it, and they are definitely through to the final. Of that I can be sure. I can't be sure of anything else, but the BVH rulers are through to the final. For sure, they have scored a perfect 10. They have got a score of 60 out of a possible 60. What a magnificent performance at this stage. There were questions on trials. There were some tricky questions as well. There were some straightforward ones. But congratulations to BVH rulers. You can be extremely proud of your efforts. Well done. Well done. How do you feel, guys? How do you feel?
We are really excited and happy to win this match. Definitely our opponents fought bravely, but one has to win.
Excellent.
And we will, inshallah, win the final match also.
Great confidence there. Everyone's a winner in the Cardiometabolic Premier League. I think there are lots of things that we learn from and you guys learn from. And that's great confidence going into the final in Lahore. I hope that I will be there to witness you compete. As yet, I'm not sure who you're going to be competing with, but that was a brilliant, brilliant performance. Well done. And congratulations to Bahawal Victoria Hospital, all of your mentors, all of your teachers, all of your colleagues. They can rightly feel extremely proud of the team that they've produced, that have absolutely dominated this contest today. Can we have the losing team who fought extremely hard and a credit to their institution today, LNH Galaxians? Well, you fought really hard, you did really well. I think you can be extremely proud of your efforts, Galaxians. You are a credit to your institution, but it wasn't to be today. What do you feel?
Thank you so much for the credit. Of course, the VVH, we are happy that they won and we wish them all the best. But I have a question. We only knew that in this cardiometabolic competition, the competition would be among the medicine residents. I didn't have any idea if the cardiology residents are allowed to compete.
That's a question.
Actually, it's a cardiometabolic. You see, it's a cardiometabolic match. You see, and therefore, I think there's an overlap between medicine and cardiology. They merge at some point, and lipids and acute coronary syndromes are well known to the internist as well. So I don't think that's very high specialized cardiology or specialized lipidology. This is internal medicine.
Thank you very much, Professor Saab. Thank you very much. Well said. If there's any issues, our umpires can look at those issues. Our umpire can look at the issues at a later stage. But for now, BVH rulers are the winners of this contest. How do you think they did, Professor Saab, the BVH team?
Yeah, they did very well, and it confirms the fact that if you know the subject, you can answer all the questions correctly. So that testifies the fact that the questions are made in a way that the fellows and our junior friends can answer. And you have seen today that the Bahawalpur Victoria team, they answered all the questions correctly and scored maximum. So I think rather than thinking that this question is out of course or not, I think it's a entire spectrum of medicine and cardiology that merge in each other. And these are the modern concepts of treating acute coronary syndromes and lipid disorders. And this is very much in the air all the time, discussions and presentations and guidelines. So I think Liaquat National also did very well. They played very well. They answered 7 questions correctly, and they fought very well. But of course, BVH has done extremely well, and they have made their way possible to the finals. So the way they were confident and they played, I think I must salute them. Bahawalpur Victoria Hospital is one of the oldest hospitals in the country. And our very dear friend, Professor Shafiq, was, I think, the first cardiologist who was posted there. And I think I was really impressed by BVH, relatively a remote, not a remote area, but can't compare with Karachi. So I think my congratulations and compliments to each and every member of the BVH team and the mentor. And at the same time, my compliments to LNH team also, who fought very well. They should not go discouraged. As we always say, there is no winner, there is no loser. We are all gaining knowledge. We are all gaining uh, uh, a confidence, a sportsman spirit, friendship, and I think these matches bring all these young doctors together as well, so they can make good friends and forums, and then they can be tomorrow sitting at our places. So I think with this, I would like to once again congratulate both the teams, in particular the BVH.
Thank you very much for your kind comments, sir. I'm sure they'll treasure your positive feedback. No doubt both teams fought extremely well, and this time there had to be one winner. And obviously the team that scored 100%, despite being asked some relatively challenging questions on clinical trials and some complex scenarios and data, the team of BVH just was absolutely outstanding, and no doubt they will be in the final in Lahore. Who is going to join them? Well, that's something for the umpires and the administrators, because we've got some teams with very, very similar scores that are battling to join them in that final contest. So what are we going to do about it? That's going to be up to the umpires and the patrons and the senior faculty to decide who is going to make it. But for now, I just want to congratulate BVH rulers, Bahawal Victoria Hospital, on a magnificent performance. Absolutely solid all the way through. No doubts, no guesswork. They just went for it, and they achieved their goals. Obviously a very, very good institute, Bahawal Victoria Hospital is. Congratulations also to the Galaxians. They got to the Super Sixes. They are also an absolutely outstanding team. They have obviously been well trained and they have very, very good knowledge, but unfortunately it's a tale of one team, only one can be the champion. And this time round, the champion team of the Super Sixes are the BVH rulers. Are they going to win the national tournament? That's the big question. We will have to find out in Lahore. But in the meantime, let's take a breath, let's regain our thoughts, and let's get ready for the next stage, which will be in Lahore. So what have we done today? We've seen a magnificent contest between two excellent teams. Really, really top level competition today. But there only has to be one winner, so BVH proved their mettle today. Thank you very much for joining me. From me, Dr. Qurbaan Hussain Khan, and from the team at Wilson's Pharma, Allah Hafiz.